Okay, now we have bacterial meningitis. So bacterial meningitis is the infection of the meninges causing inflammation. So the risk factors: young age. It happens most often in younger children. So lack of vaccines if they're not getting their vaccines. Immunosuppression, which is secondary infection. They can get it from type B strep, E. coli, listeria. That's for newborns. And then for infants and children, they can get it from Haemophilus influenza type B or HIV. There is a vaccine for that they get in infancy. So signs and symptoms of this is going to be fever. So it's just your typical signs and symptoms for meningitis. So fever, you're going to have a stiff neck. That's one of your go-tos for meningitis. Altered level of consciousness. They might have seizures. And then they're going to have these two positive signs, Kernig and Brudzinski. So the Kernig positive sign is whenever there's resistance or pain when extending the knee 135 degrees or more while the hip is flexed at 90 degrees. So they're going to have resistance or pain, and that means it's positive, and that is a sign of meningitis. The other one is going to be the Brudzinski. So this is whenever flexing a patient's neck causes involuntary flexing of the hips and knees. So if you turn and you flex the neck, and then their hip and knee involuntary flexes, that's positive Brudzinski sign, and that's a sign of meningitis. So another sign of meningitis is the bulging fontanelle in the babies. And they will often rest in what they call the opistotonic position. So this is whenever the head and the neck are hyperextended. So I drew this little stick figure. So they're laying down flat, but they throw their head back and they throw their feet back. So it's kind of like they're looking like a little rainbow. That's what they look like. So treatment and management for this is going to be IV antibiotics immediately. Once you do, you realize that they have meningitis, you want to give those antibiotics immediately as soon as possible because this is very dangerous. You can give steroids to decrease the inflammation. And you also want to put them on droplet precautions, so wear a mask. You want to administer antipyretics like NSAIDs or acetaminophen. You want to give cooling blankets, fans, tepid baths. You want to monitor complications. So you want to decrease their intracranial pressure level. You want to control seizures and prevent injuries while having one. And you want to educate the parents about importance of vaccines, like the HIV, the Haemophilus influenza type B. That is a vaccine that is very important to prevent this, and it's very important to have, so you want to educate them about that. And then you want to disinfect the toys because of those droplet precautions.